Kidney stones are one of the most painful things that a human being can possibly experience. And the older you get, the more likely it is that you are going to get to experience one of these rocky bundles of joy. So in today's video, we're going to use the cadavers to take a look at the inside of a kidney and see exactly where, why, and how they form. And on top of that, we're going to be able to see why they hurt so much. Let's do this. I will never forget this. It must have been maybe 2 or 3 years ago, and I was here in the lab, and I had a group of students here with me, and I was teaching the kidneys, and we were talking about kidney stones. And one of the students looks at me with the most intensely serious face I've ever seen, like just straight dead in the eyes, and she says to me, "I've had 6 children. I would rather have all 6 of them, all natural, back to back, than ever have kidney stones again." And I remember it was just like super quiet, and I just look at her and I say, "Well, I don't have a uterus, and I've never personally had a kidney stone myself, so I'm just gonna have to take your word for it." But what you have to understand is that her experience and sentiment surrounding kidney stones is very, very common. A lot of people do compare kidney stones with childbirth. But the thing you have to understand is that pain is actually very subjective. Meaning that if I was somehow able to give this exact same kidney stone to 2 different people and then they had the exact same experience, they're still gonna process the pain differently. And that doesn't make one more real than the other. Just understand pain is subjective. So I can't tell you how painful kidney stones are because there's a lot of different factors that go into it. I mean, like I said, it's the person, but it's also their overall health. It's the size and shape of the kidney stone. It's the hardness of the kidney stone. There are a lot of factors that go into it. Just understand that kidney stones are painful, and it may be more painful than childbirth, it may not, but either way, you do not want to have these things. So let's go ahead and take a look at the cadaver and see exactly why. You are looking at a left kidney, and I know that because this ureter right here is behind these blood vessels, which tells me that it's a left. Now, you need to also understand that the left kidney happens to be a little bit bigger and a little bit higher in the body when compared to the right kidney. And that's because the liver, which is on the right side, is so massive, it shrinks the kidney a little bit and also lowers it slightly. But on the outside of the kidney, there is a bunch of connective tissue, and you can see some of it kind of chewed up here, and that's just due to handling that it's kind of been roughed up like that. But this outer connective tissue layer is called the renal capsule or the fibrous capsule. You can kind of choose which one you want to call it. But this is true for most structures in the body, that they have a connective tissue outer layer that's just going to be very protective and just help with a variety of different problems. But one of my favorite things to do here in the lab is this next part, and you're going to love this. I can actually grab the kidney and reflect it open. And that's because we've cut the kidney in what's known as the coronal or frontal plane. And that basically just means that we've cut the kidney so there is an anterior or front portion and a posterior or back portion. And this allows us to see a ton of really cool and interesting anatomy. But I'm gonna go ahead and take this half, place it over here, and we're gonna focus today right here because this is gonna allow us to see pretty much everything we need to see. Now, in order to best understand kidney stones, we also need to understand how the kidney works in general. So the kidney does a variety of different things, but if you could just sum it up real nice and easy, it filters your blood. And that's gonna be the most relevant function of the kidney for our purposes today. So how it does that is this structure right here is called the renal artery. And the renal artery is going to start taking blood, unfiltered blood, and as you notice, it's gonna start splitting. And as it starts splitting, it's gonna start heading up to this portion here. And it's gonna be difficult to see exactly where those splits are, but it's gonna head to this outer rim here, and this is known as the renal cortex. Cortex just translates to bark, like bark of a tree, so it's a surface type region. And this is where most of the interesting things in the kidney actually occurs. Problem is, it's too small for us to see with the naked eye. But inside of this cortex are a bunch of tiny little filtration units that are going to filter the blood for us. So we take the unfiltered blood to the cortex, it becomes filtered, and then what's going to happen is that newly filtered blood will be deposited into the venous system. And it's going to go back that same pathway, it'll just be a different tube, and it will then exit the kidney right here in this structure known as the renal vein. So we bring blood in through the renal artery, and then we take blood out that's been filtered to the renal vein. And the renal vein is then going to connect to a larger blood vessel, which will then transport it to the heart. So just think about it like this. The heart pumps blood to the kidneys to be filtered, gets filtered, and then gets sent back to the heart. But it doesn't send, obviously, all the blood at once. Otherwise, it'd be a closed loop and you'd never get blood anywhere. This whole process is happening 24/7, 365. You are always filtering your blood, and that's a good thing, because if you weren't filtering your blood, the blood becomes very toxic very quickly, and we'll see exactly how that happens in just a moment. But when it does filter out these particulates, they have to go somewhere. So where they're going to go is into this next region here that we call the renal medulla or medulla, and that just basically means marrow, but it's just this middle-ish portion. So we have the cortex on the rim, and then we have this inner portion that we call the medulla. But inside of the medulla are going to be all these really cool looking structures called renal pyramids. And if I had done the dissection differently, we would actually be able to see that these structures do in fact have a pyramidal shape to them. They're really, really cool. So human beings have on average around 7 to 8 of these inside of the kidney, but you can actually have more. This just comes down to variability within the species. But what's going to happen is when the blood has been filtered, all the stuff that your body decided it didn't want is going to be dropped into these renal pyramids. And it's going to drop down. There's tiny little tubules just located inside of here. And it's then going to get to these next structures right here called the renal papillae. And papilla just means nipple. So if you were to look at these, they do have a kind of nippular shape, I guess you could say. And this structure is going to be important for kidney stone formation as we go forward on. And we also have to understand that now we have a new substance. We're going to start calling it urine. So urine is going to be composed of particulates, things that the body deemed as being waste or just it outright didn't need, and it's going to mix that with water to form urine, and it's then going to go into the urinary tract. So this is where the urinary tract is going to begin, is in these renal pyramids to the renal papillae, and it's then going to go into another structure here called the calyxes, or the calyces. Now, calyx means husk, like the husk of corn. So that's where it gets its name. And this is going to be very important for kidney stone formation. And it's then going to come over to this structure here called the renal pelvis. Pelvis is just base. So this is the base of the kidney because renal also means kidney. And then the urine is then going to go down this very long tube that we call the ureter. And the ureter, which we've obviously cut here, would then be connected to the bladder. And then the bladder, which is just a storage facility for the urine, would then have the urethra coming out of it to drain the urine out of it. Now that we know how the kidneys filter blood, we can begin to discuss the process with which kidney stones will form. And probably unsurprising to you, it's going to happen in the urinary tract. So the urinary tract, again, begins here inside of the collecting tubules of the renal pyramids, and then will end with the urethra. Now, kidney stones come in a variety of different flavors, types, I don't know, it's probably a better way to say that. It's about 5 types on average, but we're just going to go ahead and kind of even the playing field and just say that it's one type, and that's going to be calcium oxalate. The reason why I say that is because calcium oxalate make about 80% or so of the stones that do form, and that's pretty much throughout the entire urinary tract. But what you need to understand is that they form due to what's known as supersaturation. So urine, again, is going to be a byproduct. It's going to be that, so the blood filters it, and it comes down here, and you're going to have a lot of different components inside of your urine in this area, such as urea, which helps to give urine its name, but you're also going to have water. You're going to have hormones. You're going to have things that you basically are just outright waste products, are toxic to your body, and you're also going to have things your body just has too much of, such as hormones like human chorionic gonadotropin. That's HCG, and that's the hormone of pregnancy. It's what alerts the body to let you know that you're pregnant. And so what will happen is you will urinate out the excessive amounts of it, and then we can detect that with a pregnancy test. So we can do that with a variety of different substances. But one of the things that is also going to be in there are electrolytes. Now, electrolytes are not just found in Gatorade, right? They're all throughout your body. These are going to be charged particles, such as like calcium, sodium, potassium. Now, calcium is going to be the most relevant to us due to the fact that we're dealing with calcium oxalate stones, but just understand that electrolytes are also going to attract water to them. So for urine to flow throughout your urinary tract, what will happen is the kidney will actually deposit in electrolytes to attract water from the blood, from the interstitial tissue of the kidney itself into there. So then you have this liquid that'll more easily be transported down through the system. Now, the thing is though, if you have too many electrolytes, specifically in this instance, we're going to say calcium and oxalate and phosphate, what will happen is you get supersaturation. And when it's supersaturated, crystals can begin to form inside of the urinary tract. Now, typically, they're going to form here in the collecting tubules of that renal pyramid and in the papilla of the renal pyramid. And so this is where you have this event called nucleation occur. And then what's going to happen is it's slowly going to start to get bigger, and all the crystals just start merging into what we call aggregation. So they start getting larger. So we have an aggregation event. And that's when it's going to form a much larger stone. And I actually have a kidney stone right here that we can look at to get a kind of understanding as to the size of this thing. So I went ahead and measured this kidney stone beforehand, and it's about 7 millimeters. So you have to understand that below 5 millimeters is often seen as being easily passable. I don't know if that's always the right term for it, but meaning that it usually doesn't require intervention. All you have to do is observe it, let it pass, and things are going to be fine. Between 5 and 10 millimeters, it's still passable, but you're probably going to need some kind of intervention, such as medications, or we'll kind of get there in a bit. But they can get even bigger than that. They can get all the way up to 20 millimeters. That's ridiculous. That's like 3 times the size of this stone right here. But you can see that so let's go back here. So once it nucleates and aggregates, it's then going to kind of set up shop in either the calyxes or the renal pelvis or the ureter, any of those places we mentioned earlier, and it's just going to continue to grow and grow and grow until it gets pretty massive to the point where it will then detach and it will start flowing through with the urine until it reaches this point here. And this is where we begin to have a pretty big problem, because you can see already that this stone is going to be bigger than the tube itself. The ureter's diameter is about 4 millimeters. This is why 5 millimeters and below is more handleable. Is that a word? I don't know if that's a word. And then anything above that is going to create issues. And you can see that the shape is also going to be crazy. These kidney stones can have some crazy shapes that look like they're from the bowels of hell or something like that. And so what will happen is this, not only is it massive, it's pokey and jagged, and it's going to start to go into this tube. Now, one thing you have to understand too is how, and I'll move this kidney stone for a second, is how the urinary tract puts urine or moves urine through the body. What will happen is this tube here is layered, and there is a muscular layer to it that will actually contract. So what will happen is the ureter is normally closed, which makes sense. You don't want to have the tube just permanently open, because imagine if you did a handstand, all the urine from your bladder would go up the ureter and back to the kidney. That doesn't make much sense. So it's going to be closed off. But as the kidneys filter more blood and make urine, what will happen is it'll eventually open up and it'll allow urine to flow into it, and then it will close behind it. So you have this discrete chunk of urine that's going to be through here, and then the tube is going to contract and squeeze it down. We call this peristalsis. And this happens in other places in the body too, like your cardiovascular system, your digestive system. But this is how you're going to move urine down into the bladder. And I'm sure you know exactly what I'm talking about, and if you don't, you're lying. Have you ever been sitting on the toilet, on your phone for way too long, and all of a sudden just more pee comes out? Wait a little bit longer, then more pee comes out. That's pretty much the peristalsis in action, just kind of moving. That's the amount of urine you've been making while you've been sitting there, essentially. But the reason why I bring this up is because now I bring the kidney stone back. When that kidney stone, I can try and center this a little bit, kidney stone reaches this point, it's going to start to try to go down. And as it does that, the tube is going to start cramping around it, and it's going to attempt to push it down. And this is one of the biggest reasons for having so much pain, is the tube is just contracting, that muscular layer is just cramping and pushing around it in an attempt to push that entire stone down here. And I'm gonna do my best. Let's look at this. Let's see if we can get a side-by-side comparison. Kind of pull this up here so you can see just how big this is. I mean, even if it's going parallel, it's still a pretty big stone. But if it's even going this way, that's even more of a problem. But I even have other stones. Look at this. So I measured this stone and this stone. These stones here, again, I don't know their exact composition. I haven't done any kind of analysis. I imagine they're probably calcium oxalate or calcium phosphate, but they get to be bigger. The biggest stone we have here is going to be, I think, this one, which is around 9 millimeters. And you can see the problem here. Just like compare the tube and then compare the size of it. And you can see that we have a pretty big problem here that it's just not going to fit. And that's where you're definitely going to have to start doing what are known as interventions. Interventions are going to be things like medications such as painkillers or muscle relaxers, which are going to focus on that ureter, which makes a ton of sense, right? If you can get it to relax and open up, it's going to be easier for that stone to then pass through. But it's also going to be things like surgical procedures, such as shockwave lithotripsy. This is where you'll lay down and they will send focused sound waves through water and your back into the kidney to help pulverize the stone. But this depends on the hardness of the stone, which depends on what it's made of, depends on the location. So it may take only one session, it may take multiple sessions, or that may not even be the best way to go. They may have to go in actually and cut through your skin, into the kidney itself and extract the stone that way. But another option is going to be what's known as a ureteroscopy. And a ureteroscopy, they go up the urethra, into the bladder, up the entire ureter, and then into the kidney itself if they need to go that far. And they have a little basket that they can actually grab the stone and pull it. Or they can even have a laser attached to it, which will laser the stone. And then they use the basket to capture the stone fragments or as much as they can and pull it out like so. So these are going to be things that, I mean, it makes things easier, but they come with their own set of issues, and each of them have complications. They have their own set of pain. It's one of those things that it's like, even if you're making the stone, let's say you were able to obliterate it and make it smaller, well, you still have to pass a lot of fragments. Say like if we just did the shockwave lithotripsy, you're still going to have to pass those fragments, and they may be much smaller. They should be smaller than 4 millimeters, which will make it much easier, but it's not as though it's going to be outright comfortable to do so. But in the end, it's going to be obviously much better than if you didn't laser it or obliterate it with shock waves in the first place. Okay, so you're probably wondering now that I've terrified you to your core, or if you've had these before, you already know, like, what can I do to prevent this from happening? What's causing it in the first place? And the things that we see, it really comes down to two main ones, and that's going to be a genetic predisposition, you have a family history of it, or it's going to be based around your diet. But even if it's one of those two things, the end result is going to be that supersaturation that we mentioned. You're going to have too much calcium and oxalate and phosphate inside of your urinary tract. So diet is going to be something that you can very readily control, and you're going to want to partake in foods that are going to be lower in oxalate. So you want to avoid things like beans or potatoes or spinach for that nature. You can find lists of the foods that are going to be lower in oxalate or higher in oxalate. You're going to want to have foods that have a better source of calcium. But the main thing, well, maybe I shouldn't say the main thing, but one of the biggest factors is actually just going to be properly hydrated. You're going to want to make sure that you're urinating, because if you are properly hydrated through proper sources of hydration, not just drinking, say, like soda or cola specifically, because colas have also been shown to have a strong link to kidney stone formation. So if by drinking enough water, well, maybe I should say this first, if you're dehydrated, well, then you're going to have supersaturation because there's less water content inside of your urine. But if you're properly hydrated, you can have a more normal saturation level and make it far less likely for you to have those stones. So it's probably no surprise to anyone that the answer, or at least the best remedy or prevention method, is going to be a better overall diet and drinking water. So why are kidney stones so painful? Well, it's a combination of things. It happens to be the fact that there's a stone forming inside of your urinary tract, which can obstruct flow and create pressure inside of the kidney. It's the fact that it's sharp and jagged oftentimes, or just oddly shaped, and it's pushing its way through a tube that the tube is smaller than the stone itself. And then it's scratching and scraping its way down, the entire way down, by the way. And sometimes you might get a moment of respite or relief when it gets to the bladder, but sometimes you may not. And you also have the residual leftover feeling, even if it is in the bladder, or if it's out the urethra, of the fact that your body just went through a traumatic event, so it's trying to heal that way. So, but yeah, then it's gonna go through the urethra. And by the way, this is one of the very few times in human biology that it's worse to be a male, because he's going to have an obviously longer urethra that is then gonna have to go out. So it's a combination of all of those types of things coming together to create this just insanely, horrifyingly painful experience. Thanks for watching, everybody. Hopefully you learned something in this video, and if the only thing you learned in this video is that to prevent kidney stones, or at least give yourself the best shot at not having them, is to have a better diet and stay hydrated, then I am considering this an outright win. But as always, be sure to like, comment, subscribe, and in the comments below, if you have an idea for a video that you want Jonathan or myself to do in the future, just let us know. We're always open to your ideas. We want to give you videos that you're interested in, not just ones that we're interested in. But again, thanks for watching, and I will see you in the next video.